Let me ask you a question most men think about, but rarely say out loud. What really happens if you ejaculate every single day? Is it a harmless habit, a secret boost, or something that slowly drains you? Could it sharpen your performance or quietly sabotage your energy and desire over months and years? If that thought has crossed your mind, you are far from alone. I hear this exact question in clinic conversations all the time, from younger men to those well into their later decades. It sits in the shadows of masculinity, wrapped in half-whispers, myths, and a surprising amount of guilt. Yet it touches core parts of health, relationships, and self-confidence. Today, we're bringing it into the light. I'm Dr. Ivy. I've spent more than a decade helping men understand the practical biology of sexual health and how it ties into everyday well-being. In this video, I'll walk you through the whole picture, the 5 surprising benefits of daily ejaculation, the 5 potential drawbacks to watch for, and the simple signals to help you decide what's right for your body and your life. By the time we finish, you'll have evidence-based context, realistic expectations, and clear actions. No shame. No guesswork. Before we dive in, tell me where you're watching from in the comments. I read them and I love seeing this community grow worldwide. If you find this useful, hit like and subscribe. Each week I break down men's health topics most people avoid and give practical, no-nonsense advice. Right up front, let's clear the biggest misconception. There is no single rule that fits every man. Daily ejaculation isn't automatically healthy, and it isn't automatically harmful. The effects depend on 3 things: why you're doing it, how you're doing it, and what it's doing to your body and mind over time. Some men report clearer sleep, less stress, and more emotional balance with daily release. Others notice dulled desire, fatigue, or emerging performance problems. The truth lives in the gray, in context. Your biology, your habits, and your life stage. If you felt confused or embarrassed about asking this, that's understandable. Most men were never taught the mechanics and consequences of sexual behavior in a clear, practical way. Over the years, I've made it my mission to translate scientific findings into simple tools you can use. Think of this conversation as doctor to friend. My job is to explain what's happening in plain language so you can make choices that fit your goals. Okay, let's go through the 5 surprising benefits one by one. Benefit number 1, pleasure hormones and mood regulation. It's not just a feeling. Orgasm triggers a predictable biochemical cascade. You get a rush of dopamine, the brain's reward and motivation chemical, a release of endorphins, natural pain relievers that also calm the nervous system, oxytocin, which strengthens bonding and feelings of closeness, and serotonin shifts that help stabilize mood. That combination acts like a small psychological reset. Anxiety eases, tension drops, and you may find yourself calmer and more present afterward. Practically, that can translate into fewer snap reactions at work or home, smoother interpersonal interactions, and a small but meaningful lift in day-to-day resilience. It's not a cure for depression or anxiety, but for many men, a regular sexual release becomes a steady mood-regulating tool. Benefit number 2, better sleep quality. After orgasm, many men notice they fall asleep faster and sleep more soundly. There's a hormonal reason. Prolactin levels rise after orgasm, and that hormone promotes relaxation and the onset of sleep. Combined with the stress-relieving effects of endorphins and oxytocin, sexual release can work as a natural sleep primer. For men who struggle with racing thoughts at bedtime or mild insomnia, this can make a measurable difference in how quickly they drift off and how restorative sleep feels. Better sleep means better recovery, sharper cognition the next day, and improved metabolic health, so the sleep benefit reaches far beyond just feeling sleepy. Benefit number 3, better blood flow and vascular fitness. Orgasm and sexual arousal are physiological events. They elevate heart rate, increase blood flow, and dilate blood vessels. In effect, sexual activity acts like a short bout of cardiovascular exercise focused on pelvic circulation. Repeated, healthy blood flow supports erectile tissue health, helps maintain endothelial responsiveness, and keeps the vascular system adaptable. Emotionally, better circulation tends to improve erection quality and sexual confidence. Practically, think of it as a small, targeted workout for the circulatory system. Not a substitute for gym time, but a complementary activity that supports cardiovascular and sexual health. Benefit number 4, lower risk of certain prostate problems. There's credible epidemiological evidence suggesting a link between more frequent ejaculation and lower prostate cancer risk. Large prospective studies have observed that men who ejaculated more often across a month, particularly into their middle years, showed a reduced incidence of prostate cancer over long follow-up periods. The leading hypothesis is mechanistic. Ejaculation may help clear the prostate of stagnant secretions, inflammatory substances, or cellular debris that over decades could contribute to malignant changes. That doesn't mean sexual activity replaces screening or healthy lifestyle choices, but it does add another plausible preventative benefit to sexual health practices. Benefit number 5, immune support and general well-being. Sexual arousal and orgasm have been associated with short-term rises in certain immune markers, like immunoglobulin A, which plays a frontline role in mucosal immunity. Lower stress after orgasm also supports immune resilience because chronic stress suppresses immune function. So while the immune benefits are subtle and not a replacement for vaccines or good hygiene, sexual activity can be one small contributor to overall immune robustness and a sense of well-being. Now we have to talk truthfully about the 5 potential drawbacks. These aren't guaranteed. They're what I see in clinic when patterns become unhealthy or habits are poorly managed. Drawback number 1, compulsive or addictive patterns. There's a big difference between a chosen, pleasurable routine and a behavior that has become compulsive. When ejaculation becomes the primary response to every uncomfortable emotion, boredom, stress, or loneliness, it can start to hijack your reward pathways. Biologically, compulsive repetition reshapes neural circuits. Emotionally, it creates cycles of guilt and secrecy. And practically, it wastes time and erodes intimacy with real partners. The core question here is, are you choosing release, or is the urge choosing you? If the latter, that's a red flag worth addressing with structured support. Drawback number 2, emotional avoidance and single-tool coping. Using sexual release as the only coping mechanism prevents development of a richer emotional toolkit. Problem solving, physical exercise, social supports, hobbies, and therapy are healthy outlets that build resilience. Relying solely on ejaculation to blunt every difficult feeling can slow true healing and leave underlying problems unaddressed. Over time, that narrows your ability to handle life's ups and downs and may worsen mood disorders rather than help them. Drawback number 3, implications for fertility when trying to conceive. If you are attempting to conceive, frequency matters. Daily ejaculation reduces sperm concentration in individual ejaculates because sperm production takes time to replenish, commonly 48 to 72 hours for optimal concentration per sample. For couples actively trying to get pregnant, timing sexual activity to coincide with ovulation and spacing ejaculations every couple of days can improve the odds. This is a practical, strategic adjustment, not an argument for total abstinence, and an easy change to make when fertility is the goal. Drawback number 4, reduced sensitivity and diminished desire in some men. Too much of a consistently repeated stimulus can blunt reward. When daily release becomes mechanical or when stimulation is always rapid and patterned, the brain's dopamine response can attenuate, and the body can report less spontaneous desire and reduced sexual sensitivity. Men notice this as an emotional flattening or as lower arousal with partners. The remedy is simple and effective. Deliberate variation, occasional breaks, and mindful sexual practice can reset sensitivity and restore desire. Drawback number 5, conditioned speed and performance problems.
If your routine becomes dominated by fast, solitary, goal-oriented stimulation, you can inadvertently train your nervous system to finish quickly. Over time, this shows up as premature ejaculation or difficulty pacing during partnered sex. It's a learned response, and the good news is it's reversible. Techniques such as paced breathing, edging, pelvic floor awareness, and mindful foreplay retrain timing and restore rhythm. The key is to practice slower, relational patterns rather than always sprinting to the finish. So what's the bottom line? Daily ejaculation isn't a universal prescription nor a universal contraindication. The determining factors are purpose and consequence. Ask yourself, why am I doing this? For stress relief, intimacy, pleasure, or out of habit? How does it make me feel afterward? More rested and present, or drained and flat? Is it interfering with my goals? Relationship quality, fertility,
Work, or emotional balance? Here are practical, actionable tips you can use starting today. Track your responses. Spend 2 weeks noticing patterns in energy, mood, sleep, and sexual desire after daily release versus spacing it out. Be strategic if you want children. If conception is the goal, space ejaculations every 48 to 72 hours around fertile windows. Vary your routine. Change timing, duration, and context, couple sex, longer foreplay, or non-sexual bonding to protect sensitivity. Build other coping tools. Add exercise, social time, mindfulness, or creative outlets so sexual release isn't your only stress reliever. Watch for red flags. If sex becomes compulsive, causes guilt, or damages your relationships or work, seek help from a clinician or therapist specializing in sexual health. Slow down in the bedroom. Practice birth control, edging, and pelvic floor awareness to retrain pacing and enhance partner pleasure. If any of this stirred worry about erections, pain, prostate changes, or persistent anxiety, don't ignore those signals. Those deserve professional evaluation. Sexual health is medical health. Finally, if you've ever felt ashamed or uncertain about asking these questions, know this: curiosity is strength. Understanding your body gives you freedom to shape your health, relationships, and performance. Small, intentional changes like adding a break, pacing sexual activity, or expanding your emotional toolkit can have outsized benefits for energy, confidence, and connection at any age. Ejaculating every day can be perfectly healthy for some men and a sign to rebalance for others. It's not rules that matter, but self-awareness. You have the power to test, adjust, and decide what supports your goals and well-being. Thank you for spending this time with me. If this video helped, give it a like and subscribe for weekly practical men's health content. Share your thoughts below. I read every comment, and this community matters. Remember, your body is worth understanding, your health is worth protecting, and your vitality is worth investing in. Take care of yourself. You deserve it. I'm Dr. Ivy.